Our last guests today are Natalie Clark and Gloria Foss with the Novant Health Brunswick Medical Center volunteer program, and a very special guest, Mason. Natalie and Gloria, it's such a pleasure to have you here today.
Thank you.
Thank you.
Now, I'm really excited to see you, but I'm most excited to see Mason. I'm sorry, ladies, but he's actually our first canine visitor on this show, so I'm really excited, and I love dogs. But before we go into that and learn about Mason, tell me a little bit now. Natalie, I know you've been on our show before, but tell us what your role is at Novant Health.
Sure. I am the Volunteer Programs Coordinator. I help with the day-to-day activities of the volunteers and the weekly schedule. I help with some training and participate with some community events.
Good. Now, Gloria, I know you're a volunteer. How long have you been volunteering?
My husband and I both retired in 2013. He was from the Duke Power, and I was Brunswick County Schools. Well, the first day of my retirement was our first day at Novant in October of 2013. And the more we got used to all the volunteering and how good the program was, we heard by accident that we were going to start the program with dog therapy, and we jumped right on that. That's mine and Michael's love. So I've been working there for maybe a year and a half now.
Sure. And your husband Michael, he volunteers also, is that correct?
He's
it's a family affair,
It's a family affair, yes he does.
Well, I hear the new program is called Wagging Welcome, and I'm excited to learn about that. So share a little bit about the program, Natalie. How did it all start?
Sure. Our program started out, actually was called Wagging Wednesdays.
I thought that's what it was,
Yes.
and you've changed it.
We did. As more of the pet therapy dogs came available, it quickly turned into Wagging Welcome. So now we offer our little pet greeters Monday through Friday in our lobbies.
Well, Gloria, tell me a little bit about Mason, and then how is it that he volunteers?
Okay, Mason is a rescue dog. He was rescued by our son.
Hey, Mason. Pretty baby.
And when our son was stationed overseas, then we came to adopt Mason while he was out of the country. And upon his return back to the United States, we told him he could find a different dog. And so then Mason, when we found out about the program, they were going to be putting the pet therapy into Novant, we said we're doing that, so we've got to do that. That's our love. Because we both like giving back to the community, and Mason never meets anybody that he doesn't enjoy or doesn't love. So he's worked really well with it. He likes going out there. This morning he saw us putting our purple uniforms on, and he knew
it was time to go.
He knew it was his time. He went and sat by the back door waiting
to go to work. Huh? Well, does Mason have any special training?
He does. He does. Part of our program is that you have to be certified as a pet therapy dog, and we received that. We investigated here in Brunswick County. We went to Canine Academy right close to the hospital, and Loretta worked with us and evaluated the dog, and we took a couple of classes, and she said he was a natural. So he's been doing this for about, he was the first dog on December the 2nd. For about 3 months now, he's been working out at the hospital. He sometimes works 1 day a week, and sometimes he works 3 or 4 days a week, depending on what the schedule demands.
And when you say he works, what is it that he does? He greets people? And
when people come into the hospital, we're set over to the side, and we don't actually aggressively greet people that way. They see the dog, and they can have given the opportunity to come over and talk to him. The minute he hears his name, Mason, he starts wagging his tail, and then all their hearts melt. He kind of gives people a little bit of therapy, relaxation.
Sure.
They're anxious about tests they might be taking, or somebody's having surgery, and they just seem to forget all about that for a little while. He's also come out, some people, like if the surgery's taken a long time.
Oh, yeah.
They come back out and they'll say, can we just have another hug for Mason? And so he's willing to give out hugs, and sometimes occasional kiss if he's necessary.
Yeah, I've had my nose kissed by him a few times. And we love puppies, don't we? Mason, what a good boy. Yeah, what a good puppy. I would think that maybe some people would be concerned about germs or, the cleanliness. Natalie, tell me how you ensure both the patient safety as well as the dog safety.
Sure. We set up our handlers and our dogs over to the side in our front lobby, and we give enough access for patients or people that may not want to have engage our dogs, so they have plenty of access to get where they need to go. And then we also ask that anyone approaching the dog uses hand sanitizer before and after petting the dogs.
Great. Gloria, how do the patients react when they see him?
We've had very good responses to Mason. We've had some people describe him as 100% pure love.
Yeah, I can see that.
That was a Marine that has been in there, and he was worried about his dad, and he came by and he said that I love this. He says it's unconditional love, and he doesn't care. We've had some people that have connected with the Mason. They've said, you know, my dad really loved dogs. So can I just please have a hug so I can be closer to him today? They were feeling kind of melancholy about that. So he's really enjoyed it, and the people have enjoyed having him there. We have some regulars that come down. They know that Thursday's his day, and they'll come out to see him and just to say hi to Mason. So he's kind of spoiled, I believe.
Oh, boy.
It's hard work, but he loves it.
He does.
Are there other dogs in the Wagging Welcome program?
There are. Right now we have 6 dogs and 6 handlers. The owners are their handlers, and they're in the program, and they have days of the week that they've been assigned to. We want to get the dogs up to at least two dogs. That we have the opportunity to put 2 dogs at one time in the lobby, or we can have from like 10 to 12 and then 12 to 2. And we're expanding the program. Next week I'm meeting with 4 other people that already have the dogs and have been certified and gone through the process. So we're just doing the last little bit about the dogs.
Oh, that's great.
And I met with one this morning when we were there at the hospital, and she's excited about joining the program. So it's growing. So anybody wants to come out, this is a great opportunity.
Yeah, so they're all different kinds of dogs, right? Big, little,
we have
different breeds.
Let's see.
We have a border collie.
We have a Gordon Setter. We have 2 golden labs. We have a we have 2 labradoodles.
Oh.
And our labradoodle, we have his brother, his adopted brother. Tango is going to be. He's in training right now, so it's a 7-week course, and at the end he's certified, with his good citizenship and his availability. She does the evaluation. We went to the Canine Academy here in Brunswick County, and she does that evaluation, and she lets you know what are your dog's problems. Even if you've got a dog that needs just a little bit of tweaking, maybe it used to do it a long time ago, she'll work with them, and it works out really well. I was appreciative that it was local, that we could get that done.
Great. How about other dogs? Are patients or families' dogs allowed to come into the facility?
Well, currently we just provide our pet therapy dogs that go through all this special training that Gloria had mentioned, and then we do make exceptions at our hospital for end-of-life care type conditions, or if someone's had an extended stay, 10 days or more. But if anyone had further questions, they certainly could call the hospital, about any pet policy.
Yeah, that makes sense. It seems like such a great program, and I don't know why everybody doesn't have it, and I don't know why we didn't have it sooner.
Sure. It's wonderful.
So as we wrap up, is there anything else that you would like to add?
I would like to say they don't have to be a dog owner to participate in our pet therapy program, because we certainly can use pet therapy assistants, and they would help set up for our pet visits and ensure that people are using the hand sanitizers before and after.
Right.
And then eventually they would help initiate those visits to the patient rooms, and that program should actually be starting sometime in March.
Great. If they're interested in getting involved, is there a number?
Sure. They would just need to call 910-721-1493, or they could stop by the hospital, and then very soon we'll be having our volunteer applications available online, and they can pull that up at www.novanthealth.org.
Great. Well, thank you so much for being here today. It's been a pleasure. And Mason, it was great to have you.
Say thank you. We enjoyed it, didn't we?
Mason.
Thank you so
enjoyed it.
much.